Okay, Bismillahirrahmanirrahim. Today's topic of discussion is radiology revision, the investigation of choice and classical science in one place. Let's start from investigations of choice. So, acute stroke के लिए first line is non-contrast enhanced CT scan, which show hyperdense middle cerebral artery, while the investigation of choice of stroke is MRI, diffusion weighted MRI, which shows restricted diffusion. Next is for subarachnoid hemorrhage, you have to rule out bleed like non-contrast CT scan, and then you can do lumbar puncture, which shows anthochromia. For any aneurysm, the gold standard is digital subtraction angiography, and for screening, CT angiography is used. For multiple sclerosis, investigation is MRI brain, T2 or FLAIR weighted sequence which show periventricular plaques which are Dawson figures. Next is brain abscess. Once again same investigation, MRI, diffusion weighted MRI which shows ring enhanced lesion and restricted diffusion. For acoustic neuroma, investigation of choice is MRI. So you can summarize for the soft tissue tumor, investigation of choice is MRI. Next is for pulmonary embolism, investigation of choice is CT pulmonary angiography, but if patient is pregnant or renal failure, then you can do ventilation perfusion scan. Next is for interstitial lung disease, investigation of choice is HRCT, which show pulmonary fibrosis, reticulonodular opacities, or honeycomb appearance. For bronchiectasis, same investigation of choice, HRCT, which show tram track sign or single dot sign. Solitary pulmonary nodule is thin slide CT scan. Next is aortic dissection, investigation of choice is CT angiography, but if patient is unstable, you can do echocardiography. For coronary artery disease, to detect ischemia, you can use myocardial ischemic scan, perfusion scan. For left ventricle function, cardiac MRI. Next is esophageal cancer show rat tail irregular barium swallow, while ecclesia cardia show bird beak appearance. Bird beak appearance is present in both ecclesia cardia and sigmoid volvulus. For Zeneca diverticulum, you can see the posterior outpouching. Double bubble sign is for duodenal atresia. Triple bubble sign is for jejunal atresia. For mild rotation or volvulus, you can do upper GI contrast, which show corkscrew small intestine. Meckel's diverticulum is diagnosed by Meckel's scan, which show ectopic gastric mucosa. For active GI bleeding, investigation is CT angiography. For Crohn's disease, CT or MR enterography. Crohn's disease shows string sign or ulcerative colitis show led by appearance on barium enema. Acute cholecystitis investigation of choice is HIDA scan, which show decreased visualization of gallbladder. Cholelithiasis, MRCP, ERCP, biliary atresia, HIDA, followed by cholangiography. Hemangioma can show peripheral nodular enhancement. Focal nodular hyperplasia show delayed central scar on MRI. For hepatocellular cancer, triphasic CT scan which show arterial phase but washout. Pancreatic cancer show double duct sign on contrast enhanced CT scan. For genitourinary renal stone, you can do non-contrast CT scan. For obstruction, screening is done by ultrasound followed by DTPA or MAC3 scan. Renal scarring on cortical area is seen by DMCA scan. Renal artery stenosis, once again you can screen by angiography, and gold standard is digital subtraction angiography. Posterior urethral valve, you can do maculating cystourethrogram. Two pediatric abdominal tumors are Wilms tumor and neuroblastoma. You can do CT abdomen. Main differentiating point is neuroblastoma has calcification and neuroblastoma can cross midline, while these two features are absent in Wilms tumor. Next is bladder cancer investigation of choice is cystoscopy with biopsy. Next is women imaging. Mostly ultrasound is used for ectopic pregnancy or placenta previa, TVS, ovary torsion, ultrasound Doppler, ovarian dermoid, ultrasound which showed tip of iceberg, endometrioma, MRI showed T2 shading, PCOS, string of pulse appearance. For previa, TVS, Ecrita, ultrasound Doppler, molar pregnancy, snowstorm appearance, cluster of grapes, breast cancer, screening by mammography, osteomyelitis, MRI, bone mets, hot nodule, bone scan, multiple myeloma, cold nodule, MRI, avascular necrosis of hip, MRI, stress fracture, bone scan, MRI, thyroid nodules, ultrasound, parathyroid adenoma, system EB scan, nasopharyngeal cancer, MRI, nasopharynx, juvenile nasopharyngeal angiofibroma, contrast enhanced CT scan. Hoffman-Miller sign. Retinoblastoma shows intraocular calcification. Optic glioma, once again MRI. Optic meningioma, MRI, which show tram track sign. Next are classical radiology sign. Dawson figures, multiple sclerosis, tram track appearance in orbit, optic meningioma, racing car sign, agenesis of corpus callosum, hot nose sign, brain death, Homer-Miller sign, juvenile nasopharyngeal angiofibroma, ground glass appearance, fibrous dysplasia, soap bubble of jaw, ameloblastoma, calcified intraocular mass, retinoblastoma, bat wing appearance, pulmonary edema, hamster's hump, pulmonary embolism, infarction, Westermark sign, pulmonary embolism, oligemia, tram track sign of lungs, bronchiectasis, signet ring sign, bronchiectasis, snowman appearances, total anomalous pulmonary venous return, egg on string appearance, transposition of great arteries, boot-shaped heart, tetralogy of Follet, water bottle, pericardial effusion, okay, apple core, colon cancer, bird beak appearance, ecclesia cardia or volvulus, rat tail esophageal cancer, string sign Crohn's, lead pipe ulcerative colitis, thumbprint ischemic colitis, coffee bean sigmoid volvulus, kidney shape sickle volvulus, target sign ultrasound intussusception, double bubble duodenal atresia, triple bubble jejunal atresia, corkscrew-duodenum malrotation, water lily sign hydrated cyst disease, snowstorm appearance molar pregnancy, double duct sign pancreatic cancer, central dot sign Caroli disease, heart rim sign acute cholecystitis, cobra head urethrocoel, putty kidney or autonephrectomy TB kidney, bear paw xanthogranulomatous pyelonephritis, string of pearls PCOS, tip of iceberg dermoid cyst, T2 shading endometrioma, ring of fire corpus luteum, sunburst periosteum osteosarcoma, Codman triangle osteosarcoma, onion skin periosteal having sarcoma, soap bubble giant cell tumor, ground glass bone fibrous dysplasia, punch out multiple myeloma, salt and pepper skull hyperparathyroidism, cotton wool skull pager disease, bone in bone osteopetrosis, rugged jersey sign renal osteodystrophy, bamboo spine ankylosing spondylitis, penicillin cup psoriatic arthritis, Scotty dog collar spondylolysis, crescent sign avascular necrosis of hip.